Hello, 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 and happy day to you. I hope that your day or night, whenever you are tuning in, is going well. And yes, you have tuned into the right place. So let me tell you why. As we enter the flu season and we combine that with continuing COVID infections, the two together are called the twin-demic. You should be asking yourself questions such as, how will my family's health be impacted? Is it important for me and my family to really know or care about vaccines and consider them as essential tools for keeping us healthy? Okay, it's 2022, so what does 2023 look like for me and the family as we think about getting our health and wellness back on track? Well, guess what? We're going to help you answer those questions and more here on Your Best Life. I am Dr. Joan Prince, and I'm so excited because my guest today is a trusted physician messenger, Dr. Cecilia Howe Canada, who brings over 30 plus years of experience to this discussion. Welcome, Dr. CC, as we love to call you. How are you?
I'm doing fine. Thank you, Dr. Joan.
It's a pleasure to have you with us, and I can't wait for our listeners to hear your advice, your counsel, and as we talk about these very important matters that affect all of us. So let's set the stage. We're not going to play around. Let's get busy. Let's set the stage for our listeners. As we face another year with the topics of discussion again being COVID, the flu, vaccinations, there are lots of questions that families are asking. So for this podcast, we know that you, Dr. Cece, are going to help us answer some of those questions. Let's get started and talk about COVID first, okay? Guess what, people? It's not gone, even though you may think it is, and people act like it is. COVID is still here. All of the research shows that COVID is still around. People are still suffering from COVID. And yes, people are still dying. Our community, the Black community, is disproportionately affected by COVID. Particularly, and Dr. Cece always uses these terms when we talk about these kinds of things, particularly those that are the most vulnerable in our population. They have comorbidities, diabetes, or as we like to say, sugar's out of control, asthma, and it's not just about the wee ones, the young folks, but in our seasoned adults as well. So Dr. C, it is time to hear from you. We need your words. We need your advice and counsel. Give us your thoughts on the short and long-term effects of COVID and how it affects the health of a family.
Dr. Joan, thank you for this opportunity, first of all. And COVID is definitely around, and it's going to be around. There are long-term health effects, mainly respiratory, and that can affect the body systems. Individuals say they have, the brain fog, or they're forgetting more easily. They also indicated that they're having, as we call it in the pediatric population, the bubble guts, where their GI is upset, as well as
bubble guts. I love that. Go ahead, Dr. C.
As well as they're more prone to infection. So those are some of the long-term effects that need to be discussed with your medical provider to let them know that you are having some of the long-term health effects of COVID. The short-term effects is basically respiratory distress, which can lead to death if not addressed in an appropriate manner. We also know it's important to update COVID. The updated COVID vaccines protect people from the worst outcomes of COVID and also help to reduce the spread of COVID in communities, further reducing risk for the most vulnerable populations.
One of the things that I heard you say, Dr. C, is that vulnerable populations. So just help us understand, because again, we hear a lot and we see a lot. But what we like about these types of discussions with you, our trusted messenger, the people that our community listen to, help us understand what those vulnerable populations are. Is it just, Big Mama's age, where I am now? Is it just Big Mama's age? Or is it also our wee ones? Is it the parents of the wee ones? Can all of these age groups be affected by COVID? Or is it just those that are really vulnerable?
I think it's all age groups can be affected. We have a tendency to pay more attention to the wee ones, as you call them, the infants and the children, as well as the our older population, which we are now becoming a participant in. But you have to keep in mind that it's the middle age groups too that can be vulnerable because they're not getting the care that they need or the services to make sure that they're not being exposed and or exposing. So it's that school age population where they're sharing germs also, as well as the college population, because they may be away from home. The mother may not be seeing the cough, cold, runny nose that's lasting a long time. So I think it's all ages that need, as well as have, that special attention to respiratory symptoms.
Dr. C, you are a PDA board certified specialist physician in pediatric medicine. I like to say that. It just sounds just so darn important. And you have over 30 plus years of experience. I personally know that you have operated in several states: Alaska, Illinois, Wisconsin, you name it, we name it, you've been there. Question for you. When you see the wee ones, the little ones, as you said, school is back. They do some interesting things when they're out on the playground. That finger's going in the nose. They're coughing and sneezing on each other. Is there value still for those where CDC says they recommend vaccines for? Is there value in having that little one vaccinated?
Yes, there's value because remember, when you are vaccinating, you are jumpstarting the immune system to create antibodies to protect from any germs that are coming in either by your nose or your mouth. And so you're giving your immune system a head start to fight what they may see next time.
I love how you said that because you just validated as the trusted messenger the message that we have been spreading, which is updated COVID vaccines protect people of all ages from the worst outcomes of COVID and also help to reduce the spread of COVID in communities, which further reduces risks for the most vulnerable populations. Am I right about that?
Yes.
The trusted messenger said we're right. So remember that. So now earlier I talked about the twin-demic. You know, we can make up some names, right? The twin-demic that refers to not only COVID, but also to the flu. And it is flu season, Dr. Cece. It's flu season. So what are you seeing in your current populations, the wee ones, that middle group of Black parents who are bringing those wee ones into you? And as we like to say, that a highly experienced. I think someone told me the other day, they said, you're not old, you are high mileage. So I don't know which one I prefer, but for the high mileage population, so that 50 plus group of Black, usually grandparents who are part of this. Let's talk about the flu. Concerns for those that aren't vaccinated or those without updated vaccines.
In terms of the flu, it's important that you are vaccinated yearly because the strain of flu does change on a yearly basis. And so the flu vaccine is tailored to give you the most protection from the anticipated flu virus that will be hitting us for that season. In terms of the twindemic, for my population, it's actually the tridemic because we have flu, we have COVID, and now we have RSV.
Wait a minute. Well, hold up, Dr. C. Did you just create another word? Did you just say tridemic?
Yes, I did.
Okay.
I didn't create it. That's what the studies are showing.
Great.
Is that we have respiratory viruses of flu, COVID, and RSV, which are now kind of hanging out together. They have the respiratory symptoms, but each one has its own uniqueness in terms of manifestations. And so the cough, cold, runny nose that lasts more than 24 to 48 hours in the younger population needs to be addressed by your medical provider, either in person, telehealth, emergency room, whatever service is available to you. But it's just keeping us on the forefront that we just need to be on guard at different age groups.
So let me see if I understand this right. You know, my daddy used to say, child, what does that mean? What is RSV? Now tell us again. So we know COVID. We've heard the term COVID. We've heard the term flu. Tell us what the RSV is again.
RSV is respiratory syncytial virus. So that's a virus that has been around. It is generally in your younger population, your preemies, your babies that are born less than 40 weeks. And so it goes back to the respiratory status, the maturity of the lungs. Can they handle the increased secretions you may have and clear them in a manner where they can breathe? And so it's just the three respiratory viruses, COVID, flu, and RSV, coming together during this season in what we're looking out for.
So, Dr. C, I get a flu vaccine every year. I mean, it's like clockwork. Never thought about it. Pre-COVID, okay, September, early October, time to go get the flu vaccine. We don't think about it. Then COVID comes along. It's like, oh, I need my COVID vaccines. And, me, I raise my hand for any updated vaccine that comes out. So I've had all of those updated vaccines. And I had my flu shot. So help us understand, Dr. C, help us understand that the vaccines for anything that's out there is not to harm us. It's to help us with another barrier of protection and another way to fight. Can you talk to those who just are anti-everything or will say, I'll take my chances?
There is your segment of the population who has that thought process. It's also important that as you're looking for information, you go to reputable sources. Social media has a lot of good information, but it also has some information that has not been tried and true and tested by medical studies. In terms of the vaccinations that we use, they are preventative measures allowing your immune system to be activated through the antibody formation to help fight against the germs, as I said, that enter your bodies either through your nose or your mouth, as well as they help vaccinate the infants, the children, and the adults. And so as we get older, we can have what we call the levels of protection decrease. Therefore, we need our boosters to maintain our levels of protection so we can fight the germs.
So that shot in my arm helps me build all of those things we call antibodies to put the gloves up and fight if one of those viruses come towards me. So, you're making me think, Dr. C. I guess before I kiss that man, I need to make sure he's had his vaccines also, right? Let's think about that.
There is a checklist that you need to go through before you do.
Okay, that sounds like a plan. So, guess what? We have talked about the tridemic. Wow, we love to learn new things. The tridemic. But one of those things that the pandemic did for folks actually was to keep us from being up and moving and as active as we should be, right? We have Black parents and grandparents who had to step up their game in a different way, and they had to provide spaces for the wee ones in their lives to be educated, right? You never thought that you would have to try to clear out that junk room and make sure that the child has a place with his or her Chromebook or laptop or whatever to engage. That's how they learned. Parents had to work from home. Some offices said, doors closing, you're going to work from home. So we're sitting down more, right? And we're not necessarily eating right. So let's talk first about ways to get up and get moving despite those crazy schedules. Tell us what to do.
Well, I think we already know what to do. What we have to do is decide that we're going to do it. It is that mind, body, gut phenomenon that I talk about. We actually need to decide either we're going to move it or we're going to lose it. Overwhelming number of videos for beginners to advance where you can turn it on. And if you want to dance, you can do a dance routine. If you want to exercise, you can do an exercise routine. but it is available. If you know how to turn your laptop on, your cell phone on, it has a plethora of information. But the first thing is to get started. The second thing is to maintain it through the journey. And we have to realize that the body is made to move, and we need to move our body.
Got to get up is what you're saying. You can't stay planted in that recliner with that remote. You have to get up and actually move around. I like what you said. You know, as we're talking about the tridemic, we're talking about COVID, flu, RSV, and vaccinations. Part of the fight is also around getting up and exercising and presenting your healthiest body when these little viruses come knocking on your door. You've actually taken care of yourself. That's what I'm hearing you say, right, Dr. C?
Absolutely. We have to start thinking that the fuel we put in our body is to make our body healthier. Because if you're eating a lot of junk foods and sugars, you're decreasing your immune system, you're decreasing your mounted response for the germs that are coming in. You know, we have to get away from the thought of clean plate club or fast food frenzy and just reframe or we have more.
Okay, Dr. C, now you brought this up. You brought up the elephant in the room. Okay. Now, is this true confessions? Okay. Doc, we've been eating crazy foods at crazy times of the day or night in crazy amounts, right?
Yes.
I'm hearing you say that that's not good. Not good, not good, not good. And I don't know where those extra 10 to 15 pounds came from in the past 2 years. You know, it doesn't have anything to do with the fact that I'm eating a whole pizza instead of a slice. So how do we address it? Talk to us. Come on, get on us.
And, you know, I am a party to this process also. And it's basically, as I said, reframing our thought process to think about what fuel does our body need on a daily basis in terms of vegetables and fruits and less processed foods. The protein carbohydrate balance, decrease the junk foods. And, you know, inevitably, we're forgetting that we need water. We need hydration in our body to keep our skin looking good, to keep the toxins flushing out. So those are the going back to the basics to make sure that we're remaining happy, healthy, and whole.
I stopped crying because, you know, you've told me what I need to do. You scolded me about not eating the entire pizza. And so you also told me I need to get up, right? Let's try and list all of your great advice and counsel to us. And as we say in our communities, remember how mama or daddy used to say to you, okay, baby, now what did you learn today at school? Were you listening? Were you paying attention? Guess what? I was paying attention, and so were our listeners. So get your little pens and papers out, listeners, so that you can jot some of these down. Because here is what we heard today. And I'm going to ask Dr. C to weigh in on each one. So I heard COVID vaccines and all updated vaccines help in the battle against the virus. True or false?
True.
What are you telling me? Get that vaccine?
I'm telling, yes, I think it's important that we are vaccinated, the adults as well as the children and the infants in the household, not just one group, but we all want to work together to fortify that house.
One thing, and I'm going to build on that, one thing that you mentioned briefly, and it might make sense to bring this up again before we depart, masks. Are they no longer needed? Are they just for Halloween? What's the deal with the masks? Help us out.
So the mask, that's the new topic of discussion now. Do we need a mask? Do we not need a mask? I recommend to my patients that you wear a mask because that's an added layer of protection for what may be going through your mouth as well as going through your nose. And the wonderful things about masks is that if worn appropriately, it shows that there is a decrease in what is getting through.
So don't put the mask on under your mouth. Is that kind of just defeating the purpose, Dr. C?
Yes, it is.
Put it over the mouth and over the nose. Yes. I'm the crazy woman you sat next to on the airplane who had her mask on. and wiped the table down before she decided to put her hands on it. I did see a little one, Dr. C, the other day who had on the cutest Wonder Woman mask. Do little ones need those masks on?
Absolutely. And they are now part of the outfit that they're wearing. So it's a fashion statement.
I love it.
To get them to wear it.
It's a fashion statement. So it doesn't matter what your age group is. If the vaccine is readily available for your age group, you're going to roll up that sleeve and you're going to get it. One other thing that you said, Dr. C, is around vaccines help build antibodies, and it helps to build our immune system. We're going to say it again. Updated COVID vaccines protect people from the worst outcomes of COVID, and it also helps to reduce the spread of COVID in our communities, further reducing risks for the most vulnerable populations. Your take on that again?
I think that statement is tried and true. I think we need to make sure that we are protecting households as well as our communities, because we're building on our future, and we want to make sure we have a future with our children.
So if I show up vaccinated with my mask on for church, and yes, we believe in the Lord, but the Lord also gave us a brain, so we're expected to use that brain. So any kind of way that we can reduce exposure and increase our antibodies is what we're hearing you say. Is that correct?
Absolutely. Absolutely.
I just love this woman. Okay. Now, you also said something else. We're used to hearing about the twins, right? COVID and the flu. But now you're having us talk about triplets. So the tridemic has now arrived at our house. So Tell us again how to approach this new unexpected bundle of joy. 3 things on our doorstep.
So you have the RSV, which is respiratory syncytial virus. We have flu and we have COVID. And so we're looking at that in younger pediatric population to keep in mind that if you see signs of respiratory distress, you need to make sure you contact your medical provider.
So no home therapy, no home treatments. Is that what I'm hearing?
Yes, that is exactly what you're hearing.
So if I do a home test and it's positive, don't just try to treat myself. Don't go get some salve and put it on. We need to do what? What should I do?
We need to call our provider.
There you
especially if you have a younger family member in the household. You may need to also be treated. So that's why calling your provider and letting them know that your home test was positive and you have a little one in your house.
Or, as they say, a high mileage one in your house. Correct?
Yes, that's true.
Or a high mileage one in your house. And finally, Dr. C, we heard you say, get up from the table, get up from the back, push that chair back from the table, back away from the sitting desk, and get up out that chair, close the refrigerator, not before you take food out, not after you take food out, but before you take food out, and get that body up and moving. Tell
Absolutely.
us again, direct us again around this. What should we decrease? What should we increase? Tell us again.
Okay, so in terms of clean eating, we want to have vegetables and fruits, decrease your processed foods, decrease your junk food, have your protein and carbohydrates in balance, and don't forget to hydrate. Water is a beautiful thing that helps clear up our skin and flush our kidneys.
So is my 1 glass of water a day helpful, or do I need a little bit more?
You need a little bit more. You need a gallon more.
Oh, okay. So I need to start drinking soon. Okay. Dr. C, thank you for this. Thank you for this wonderful opportunity to talk about vaccines. Again, the updated COVID vaccine protects people from the worst outcomes of COVID. Remember that, people. And it also helps to reduce the spread of COVID in our communities, okay? Particularly reducing that risk for the most vulnerable populations. Dr. C, will you come back and keep us updated on healthy tips and facts regarding the tridemic and vaccines? Would you come back and join us again?
I would love to do that. Thank you.
Thank you. So wherever you are, listeners, give a big round of applause and love to Dr. Cecilia Howe Canada, the Pediatric Medical Director at Friend Health, which is a network of community health clinics in the greater Chicago area, treating those that are the most vulnerable in our communities. You can learn more about our topics today by contacting trusted messengers, such as your physician, your pharmacists, and other healthcare professionals. If you're tech savvy, you can also go to the CDC website. That's the Center for Disease Control for y'all that don't know what it is. But you can go on the CDC website for more information as well. And we heard Dr. C say, stay away from crazy messages that are not supported by one of those trusted messengers. So, folks, this is Dr. Jones signing off. See you soon.